people, when they hear the word cancer, they have many views of what cancer is. That it's long treatments, it's expensive, you don't have health insurance. Everything pops up about why you should just ignore it. And I'm here to say, no, there is every reason to pay attention to it and talk to somebody about it.
Your focus, your job, is to embrace your normal life and work this into your normal life. My job is to get you through all that.
It's definitely a combination of many people coming together and the institution putting the resources and support behind it.
Every time I wanted to get down, they say, no, you can do it, Ma. My son told me, you're the strongest woman I know. And so that really helped me a lot. My family, you know, they're just great. I'm just blessed.
Each year, more than 1,700 people enter Covenant's Cancer Care Center for the treatment of cancer. It ranges from skin cancer to tumors in the throat, colon, and brain. Each find world-class care from healthcare professionals using state-of-the-science technology. But it's rarely the science they remember. It's the compassion they find at Covenant Healthcare.
We get you all checked in here.
Jan Todaro is visiting her surgeon's office for a follow-up visit. Her cancer journey started 7 years ago.
I went to the restaurant and I wasn't feeling well. I went to the local hospital and I was there 4 days. The next thing I knew, they were transferring me to the city hospital. And I was there a month, okay? And you can imagine how many doctors, how many tests, and what all I'd went through in a month's time.
Tests eventually showed ovarian cancer, and it was spreading.
About 3/4 of women with ovarian cancer have spread at the time of diagnosis, as she did. She started out, we have a blood test that you can draw, a tumor marker called CA-125. I think she had the highest CA-125 that I've ever seen in 20 years of 64,000, normals under 35.
It was not good news. And I remember very clearly that day, it was November the 14th of 2005. And they basically told me that I had peritoneal carcinoma. It's, by what I understand, quite a rare cancer. And so it is in the ovarian cancer family. And it appeared that I was pretty advanced. They told me I was in stage 4. And so there was really no treatment for it.
Jan wasn't about to give up. The sign on her desk in Bad Axe says it all. She would meet cancer head-on and not let it get in the way of helping hundreds of people find employment through ThumbWorks.
I have people say to me, Jan, why do you still work? And I said, number 1, I love what I do. And number 2, I have a wonderful boss who has worked around all this treatment and everything that I have.
In her toughest days, when the cancer had the best of her, it seemed, and there was no quit. And Marv, I will be absent here and there. I will take my chemo, but I will be on the job the next day, and that you can't beat it.
Jan specializes with jobs in agriculture, handling placement in several counties. She didn't want to let anyone miss an opportunity just because she was sick.
She knows, you know, that the people are coming through the door, and it's our job to give them the edge for that job, or, you know, steer them in the righter direction and that kind of thing, and hook them up with who might be next looking for that employee. And so she would miss it terribly if she wasn't right here with us every day.
The staff at Dr. Guy Boike's office know that same generosity.
You know, and I'll write down on the front of people's charts different things. Yours just says apple pie. This was from the very beginning. This says apple pie.
Jan says the pies are a small thank you for the care she's received at Covenant.
I treat them because they treat me very well. And not only me, all their patients. They treat them well. And do they tell me every time when I come here what I want to hear? No, you know, but it is what it is. And I would rather have them tell me like it is than what I want to hear.
It's not always good news, and after more than 2 years of being cancer-free, there are some new numbers that aren't comforting.
You have done great, as you know, and we're at another little turning point, but you know, I don't think it's a big turning point. With your 4 cycles of Hexlin, your CA125 has gone from 35 up to 92. As you know, you were what, 64,000? Was it your highest, or was it 20,000?
Jan calls these magic numbers, which determine when she'll need to face chemotherapy again. These injections poison the cancer cells, which are forming new abnormal cells within her body.
In order for tumors to become tumors, which are our own body cells growing out of control, they basically have to have damage to their checking system, because usually if a cell has damage to its DNA, where it's going to replicate something in a bad way, the cell has a program where it's supposed to check its own DNA, and if it looks like there are errors or serious errors, either to fix them if it can, if it can't fix it, to commit cell suicide or apoptosis.
Chemotherapy and radiation is used to destroy the cancer cells, which usually can't fight against the treatments.
In the setting of cancer, there's usually a damaged repair system, and if you treat with radiation or chemotherapy, most normal cells can repair the effects of the damage, but tumor cells generally can't repair the damage because they got to become tumor cells because they have damaged repair systems.
The side effects range from nausea to hair loss.
I've lost my hair 4 times, 5 times. This is my real hair, by the way. And I've lost my hair, but you know what? It's only hair. It'll come back. And after 4 times, this time it came back, it's trying to be curly.
She's out over 5.5, 6 years, and the expected survival for stage 4 ovarian cancer is 12 to 18 months. So she's done very well, but she's had close to 40 cycles of chemotherapy on and off.
Jan always encourages straight talk from her doctors and nurses, but the truth is, every patient tolerates treatments differently.
My carrot chemo was wonderful. Those girls they're top notch, and I've been in and out of there a lot of times. The way it's set up, it's pretty open, or if you want your privacy, they have the individual rooms, but that never bothered me because, like I said, it kind of made me think, I'm not alone in this. I mean, this room is full of people, and they come and they go, and it's actually amazing. And those gals over there, I'll tell you what, they're wonderful.
7 years ago, Jan was told she was going to die. Today, she continues to fight on.
I don't pretend to be the superwoman of cancer or the superwoman of chemo. That's certainly not my point. Did it suck? Yes, it did. But you know what? It was what it was. I accepted it, and I was not going to use my positive energy to break me down. I knew I needed all the energy I had to keep moving forward, and that's what I built myself on, and what keeps me going.
You're special. You're very special.
And so are you.
Thank you.
You brought me a long ways.
You have to have a certain amount of optimism, but you have to have a big dose of honesty, and help really to set the whole course of what they're going to go through, because you don't want little things to be traumatic. And so I always liken it to a trip. You're headed on a trip, and you might get a flat tire, or you may have a detour, or there may be some bumps in the road, but ultimately you're trying to get to a point. In their case, it's a point in time with a certain outcome.
I just looked at what I went through. I looked at that as just a bump in the road for me. I had another little pothole this past week. I had a mammogram on my left breast last week on Wednesday, and the radiologist saw something he wanted follow-up on.
SueAnn's job had to be put on hold for a year after she found she had breast cancer.
I knew right from the beginning it was something I wasn't going to fool around with. I just don't have time to do that. So, and I told all my doctors, I don't have time for this, so let's get it over with. Let's get her done.
Patients with abnormal mammograms are assigned one of 3 nurse navigators at Covenant who help guide them through the process of diagnosis and treatment.
This is what we call the big book, and this is what we have everyone refer to when they first come up with a question they have.
Even when patients have a very good support system at home, sometimes some of these nitty-gritty details they don't want to discuss with their family, and they'd rather it be a nurse or someone that's a healthcare professional.
Information is shared with patients so that they understand the decisions they make with their doctors. Sometimes it's just a follow-up call. Other times it's holding their hands through a biopsy.
The people are always very grateful for the support and very happy to have us there, and there is a big need for it. We also make sure that the people don't fall through the cracks, so we make sure that the results get to the doctors quicker than they would without our assistance. As soon as that report pops up or is printed, we're on the phone. Hey, call this to the patient, or this is happening, let's get them to the next step. So we expedite the process as well, and patients appreciate that.
Everybody out here is absolutely fabulous, just fabulous. And the navigators are awesome. I can't find enough superlatives to describe them. They called every week for weeks on end. They would call to see how I was doing, especially when I was going through chemotherapy, and see, if I had any questions, if I needed anything. They're just awesome.
After surgery, SueAnn had 16 weeks of chemotherapy and was then sent to the Saginaw Radiation Oncology Center for 3 treatments. Half of all cancer patients will need the high-power X-ray treatment.
The difference between the X-rays that we use here and the X-rays that are there in a regular radiology facility is that our X-rays have a lot more energy. Usually they're on the order of 100 to 1,000 times more energetic.
The patient's anatomy is scanned into the system, which is so advanced that it actually adjusts its focus for moving tumors like those in breathing lungs.
We use intersecting beams of radiation, and the radiation generally is designed to come out in a uniform rectangular form, comes out like a flashlight beam. And the idea is if we have some deep-seated structure, we use multiple beams, and each beam brings in a fraction of the dose, but where they intersect is where the whole dose is delivered. So it allows us to deliver a therapeutic dose within, let's say, deep in the body, while still only getting much less dose to surrounding areas.
Nurse navigators followed SueAnn's progress throughout.
I have a good support system, but I know that there are some patients who don't have that support system, and I think it's important. You have to have support, and they are such a tremendous support. They make you feel like you're the most important person to them right now.
That support system includes social workers who specialize in oncology.
Emotionally, we realize that what this really brings out to them is really an experience of very deep vulnerability, and frankly speaking, being pretty afraid. And so the whole idea of what we teach is we teach a type of emotional self-care where they can learn how to manage those feelings.
SueAnn's next visit will be to a plastic surgeon.
I'm going to have reconstruction January 30th, and I'm excited about it, very excited.
There's a lot involved. Psychological changes, physiological changes. It's a lot you go through.
Liz Owen is sharing her journey with her family. Nearly 13 years cancer-free, her youngest granddaughter wasn't even born when she took on cancer and won.
My journey started, I think it was March 27, 2000. Everybody was worried about the millennium, whether the year was going to come to an end, and then I was diagnosed with cancer.
Liz opted to have her breast removed, and telling her family was almost the hardest part.
I never broke down or anything like that. I prayed a lot, and my father always told me, if you keep a good, close relationship with God, when trouble comes, you're able to handle it. And believe it or not, I did, but the problem was with my family. When I told my husband, he fell apart. My daughter fell apart. My son fell apart. Everybody fell apart. And I kept thinking, guys, this is happening to me. You got to be brave for me.
As a case manager in the Covenant Oncology department, Liz knew she'd be in good hands.
It wasn't as bad as I thought it was going to be with the surgery, and I was blessed that they caught it in a stage 1, so I didn't have to go through chemo or radiation. And then my, like I say, my work family, I got to see my doctor every day. Dr. Boike was my doctor, so I could see him every day. And it was really really great. You know, I had the support, and he would always ask me, how are you doing? All the doctors I work with, how are you doing, Liz? And everybody was really very, very concerned about me. And that made my journey much easier.
Many of her coworkers wondered if she'd return to the oncology department after her battle with cancer. She retired from that department as a case manager in 2006.
Believe it or not, when I went back, it was more beneficial to me to go back because all the patients was asking me, well, how are you? Are you okay? They were taking, looking to me, and I thought, well, gee whiz, this is really great. When I walk on the floor, I had all of the support I needed. Supported family, supported church family, my covenant family, my patients, and I stayed there until I retired. We always think of just women with breast cancer, but men get breast cancer as well.
That fact may surprise you, but it's true. 1 in every 1,000 men will develop breast cancer, and it happened to Les Tyvela.
Either put on or taken off my t-shirt, and one of my hands brushed against my left breast, and I noticed, it felt like there was not a lump, but some sort of a mass there. And I never thought about cancer at all.
A Lutheran minister, Les kept his sense of humor as he was one of the rare male patients at the Breast Health Center.
The gal who was going to be doing those tests came out, Leslie, looking around. I'm the only male there. And I said, yes, I'm coming. I'm going to have to change the way I have it all prepared. So, that was priceless to me.
At first, they are taken back. They're a little shocked because men don't expect to get breast cancer. But once it's put in perspective for them, once they understand some of the facts about breast cancer, they approach it like any other cancer. I don't think they think that, well, it's breast cancer, I don't have to worry about it, or that it's something that they have to keep quiet about. I've had men with breast cancer who have noticed that there's not much information out there about male breast cancer, so they've taken that upon themselves to contact the American Cancer Society to get ribbons made with both blue and pink in it so that it takes their male perspective into account.
Les credits his family, congregation, and especially God when it comes to his positive outcome. He admits to thinking about the possibility of death, but feels you shouldn't dwell on it.
Maybe it's good we don't think about, I don't know how much longer I'm going to be here and be hospitalized. We sort of think about our end much sooner than we should, because then we rob ourselves of the opportunity to be able to enjoy life that's here.
Les had chemotherapy, radiation, and hormonal therapy. He opted not to have plastic surgery and follows up with his doctors annually.
Covenant, among many other specialties that it has, because it has many specialties, it has that cancer care center. And it's fully staffed, and every one of the specialties are all engaged on a weekly basis, bringing into the conference their meetings of any one of them, or many of them, who may have, within the last week, had a new cancer patient. And they all weigh in on first of all, hearing what it's all about, and then they independently weigh in that conference on what they would recommend for treatment. So when you have all of that brain power, for one little dummy like me, life is good. Life is good.
Covenant's cancer team meet weekly to review current cases, Doctors rely on what could be over a dozen opinions on treatment options.
The medical profession, is in some ways very humbling because there's a large, expansive material and knowledge that not one person can know all of it. And the end result is that it's good to pool your knowledge together with pathologists, medical oncologists, surgical oncologists, radiologists, radiation oncologists like myself. If we can come together in a room and put all of our sort of understanding or perspectives on the table, it often clarifies a lot of questions, makes it clearer in terms of what the ideal treatment should be. And in a larger scale, there are national guidelines that the Comprehensive Cancer Centers put together. And what we'd like to do is to put all of our perspectives and knowledge and information on the table so that we can avoid mistakes, make sure that we've covered all the angles we can think of and come up with what we think is the best form of treatment.
In most cancers, there are multiple specialists that take care of the patient. What's unique about this approach is that they're all communicating very effectively, and it ensures that the patient gets the best possible care in an environment where they're closer to home.
Treatment options are greatly increased if cancer is caught early, and Covenant's diagnostic team is dedicated to doing just that.
This is our ultrasound machine. We do endoscopic ultrasounds. We can stage esophageal cancers to show how invasive they are. We can look at pancreatic cancer, liver cancer, and do aspirations right through the scope.
From colonoscopies to even pill cams, nearly the entire body can be scanned for abnormalities. This patient's uterus was found to be cancerous, as well as several surrounding lymph nodes. Dr. Boike is going to remove it remotely.
And this is unusual in surgery to take off your mask and your shoes and your gloves and your gown and to actually operate on someone from a distance without touching them.
This $1.5 million robot is called Da Vinci.
And one of the nice things is having 3 arms. You can grab with one and have another left hand. They're called endo-wristed. You can rotate them around quite easily, which you could never do before this technology was available. This is the blood supply to the ovary. The tube, the ovary, uterus.
Da Vinci's camera is stereoscopic, 2 cameras that allow 3D depth perception as the surgeon works, and that's not the only advantage.
You can get really close to things. Your vision is really spectacular. I think it allows you to be more precise, allows you to see more things, allows you to sit down.
It may be cutting edge, but it takes a qualified surgeon to make it work, and every surgery is unique.
Nobody's the same. Everybody's different. Every surgery is different. The only thing that's the same that you can count on is your team.
Covenant's surgical team has eagerly been awaiting the return of one of their surgical techs, Beth Bordeaux, who battled throat cancer.
I miss the doctors and the patients and the people that I've known for so long. I miss the work.
Beth is volunteering her time at Covenant as she waits for a new prosthesis that will help her talk. 2 years ago, she found out she had stage 4 cancer. Today, she's cancer-free.
I had so many angels to be thankful for, but it is by the grace of my son and my husband, the prayers of so many people, and God, that I'm alive today.
Today, Beth is driving patients to the Cancer Center in a Road to Recovery van in partnership with the American Cancer Society.
You'd be amazed the people who have to miss their treatments because they don't have a ride. Or they take a bus and it drops them off at Myers down there and they walk to Mackinac.
Everyone who visits with Beth finds inspiration, which goes a long way when you're battling cancer.
Sometimes that is the best treatment of all. It's just talk, a smile, a hug. Sometimes that's what they need the most.
Here is where they'll find what they need most. Now under construction, the new Cancer Care Center offers everything in one location, from detection to rehabilitation. Clinicians at Physical Medicine and Rehabilitation are STAR certified, a program that trains therapists and other disciplines to help support those who survive cancer.
The goal is by that 6th week, no matter what, they need to be at 90 degrees because that's where doctor says they can be, so they should be there regardless of their restriction.
Highly skilled caregivers, state-of-the-art science, compassionate professionals who help you through life-changing events.
It is immensely rewarding work to help a person to take a hold of their situation and to make the best of it, and to actually in some cases come out even stronger emotionally and spiritually and mentally than they were to begin with.
Today, renovations are underway at the Mackinac campus, a $4 million upgrade to the Covenant Cancer Care Center. Progress continues as donations come in, building oncology space for cancer specialists, nurse navigators, support groups, clinical trials, and an education resource center.
It was probably one of the more wonderful experiences in my life because I was able to meet a lot of wonderful people. People whose names I jotted down because they were the ones who brought the water to my bed. They were the ones who made sure that I had ordered food at breakfast, kind of a thing, all the way on in the hierarchy, the way we think of hierarchy of medical people, to the surgeon. But in point of fact, it's a continuum of care that was provided, and it was just absolutely wonderful.
This is a very dedicated group of individuals who come together and make sure that our breast cancer patients in this region get the best of care. We really don't see patients leaving this area anymore to get the latest for their breast cancer treatment. Covenant has definitely put their resources behind developing a program that's the best in the region.
Most insurances cover preventative annual testing, but for those who are uninsured or underinsured, Covenant offers free screenings throughout the year thanks to generous donations from the community. For more information, visit our website at covenanthealthcare.com. You can also hear from our cancer experts on how you can reduce your chances of cancer. Thanks for joining us on our journey through the Covenant Cancer Care Center. I'm Kristin Knoll.